I want to share something with you that I've observed over 3 decades of treating patients with cardiovascular disease, something that rarely gets discussed in clinical practice, and something that fundamentally challenges the way we've been taught to think about heart health. We spend billions of dollars annually on cholesterol medications, yet many patients continue to experience arterial dysfunction, reduced circulation, and progressive cardiovascular decline, despite their cholesterol numbers looking absolutely perfect on paper. What most people are never told is that cholesterol is only one small piece of a much larger puzzle, and today I'm going to explain exactly what that means for your health and what you can do about it starting immediately. Let me start by explaining what happens in a typical medical appointment when someone comes in concerned about their heart health. When you visit your doctor complaining of fatigue, cold extremities, declining stamina, or simply feeling older than you should, the first thing we do is order blood work. We check your cholesterol levels, your LDL, your HDL, your triglycerides, and we compare those numbers against established guidelines that have been refined over decades of research. If those numbers are elevated beyond acceptable ranges, you're prescribed a statin medication. Your numbers improve within weeks, and everyone assumes the problem is solved. Your doctor is satisfied, your insurance company is satisfied, and you're told you're being responsible about your health and doing everything right. But here's what we see clinically that patients almost never hear about. Your arteries may still be inflamed, stiff, and functionally compromised even when your cholesterol is perfectly controlled. The medication addresses one biomarker while the underlying arterial damage continues silently year after year, creating a false sense of security that everything is fine when the reality is quite different. The real issue isn't cholesterol alone, and this is where medical education has created a significant blind spot in how we approach cardiovascular health in clinical practice. The true problem is what happens to the endothelium, which is the delicate inner lining of your blood vessels. This single layer of cells, barely visible under a microscope, produces nitric oxide, a molecule that keeps arteries flexible, prevents dangerous platelet aggregation, regulates blood flow throughout your entire body, and protects against inflammatory damage that accumulates over time. As we age, especially beyond 60 or 70 years, this endothelial function deteriorates rapidly and progressively. Chronic inflammation sets in, arteries lose their natural elasticity, circulation declines to your extremities and vital organs, and your cardiovascular system begins to fail from the inside out. No cholesterol drug directly addresses this fundamental problem because statins work by blocking cholesterol production in the liver, not by restoring the functional capacity of your arterial walls or improving the health of that critical endothelial layer. Think about it this way. Your arteries are like flexible rubber tubing when you're young. Blood flows smoothly, they expand and contract with each heartbeat, and they respond dynamically to your body's changing needs throughout the day. But as you age, especially if you've had decades of poor diet, chronic stress, lack of exercise, or exposure to environmental toxins, those arteries become more like rigid pipes. They lose their ability to dilate properly. They develop microtears in the endothelial layer, inflammatory cells accumulate in the walls, and calcium deposits begin to form. Lowering your cholesterol doesn't reverse any of this structural damage. It's like painting over rust on a car. The surface looks better, but the underlying deterioration continues. Now, university research conducted over the past 2 decades has identified something truly remarkable, something that challenges everything we've been taught about cardiovascular intervention and what's actually possible with simple dietary changes. A simple drink costing approximately $1 per serving has been shown in multiple clinical studies to restore endothelial function more effectively than many pharmaceutical interventions that cost hundreds of dollars per month. I'm talking about concentrated beetroot juice. Not some exotic supplement shipped from remote regions, not a proprietary formula with mysterious ingredients, just pure concentrated beetroot juice that you can find in any health food store and many regular grocery stores across the country. Here's the biological mechanism, and I want you to understand this clearly because it explains why this works so profoundly for cardiovascular health. Beetroot contains extraordinarily high concentrations of dietary nitrates, natural compounds that exist in the soil and are absorbed by the plant as it grows. When you consume these nitrates, something fascinating happens in your body through a process that scientists have only recently begun to fully understand. They're converted first in your mouth by beneficial bacteria on your tongue, then further processed in your stomach and intestines, ultimately transforming into nitric oxide through a complex biochemical pathway that doesn't require any synthetic chemicals or pharmaceutical intervention whatsoever. This nitric oxide then enters your bloodstream and directly relaxes the smooth muscle cells that line your arterial walls. Blood vessels dilate almost immediately, blood pressure decreases measurably, oxygen delivery to tissues improves throughout your body, and your heart doesn't have to work as hard with every single beat. What the research shows consistently is that this effect is particularly pronounced in older adults whose natural nitric oxide production has declined significantly compared to their younger years. Clinical studies, and I'm talking about rigorous university research published in peer-reviewed medical journals, have demonstrated that a single glass of concentrated beetroot juice can lower blood pressure within 2 to 3 hours of consumption and maintain that beneficial effect for up to 24 hours afterward. More importantly, and this is what excites me as a clinician who has spent decades watching patients struggle with cardiovascular decline, regular consumption over weeks and months appears to restore arterial compliance, meaning your blood vessels actually regain some of their youthful flexibility and responsiveness. This is something cholesterol medications simply cannot accomplish because they work through an entirely different metabolic pathway that has nothing to do with arterial elasticity or endothelial health. We're talking about two completely different mechanisms of action here. I've seen patients in my practice who have been on statins for 15 or 20 years. Their cholesterol numbers are excellent. Their doctors congratulate them at every visit. But they still complain of fatigue, poor circulation, cold hands and feet, difficulty with physical exertion, and a general sense of decline. When we actually measure their arterial function using specialized ultrasound technology, we often find severe endothelial dysfunction despite perfect cholesterol levels. These patients are doing everything right according to conventional medical wisdom, yet they're still suffering because we're not addressing the actual problem. They're managing a number on a lab report while their arteries continue to stiffen and lose function. Now, who benefits most from this approach? And why does age matter so dramatically in terms of the response we see? Patients over 65 consistently show the strongest physiological response because their baseline nitric oxide levels are typically very low, sometimes less than half of what they were in their 30s and 40s. The decline begins gradually around age 40 and accelerates significantly after 60. Younger individuals still produce adequate nitric oxide naturally through normal metabolic processes, so the additional benefit from dietary nitrates is less dramatic and less clinically significant. But for aging populations, particularly those over 70, this represents a profound opportunity to support cardiovascular function using nothing more than a concentrated vegetable extract that nature has provided. The difference in arterial function can be measured objectively using ultrasound technology that assesses flow-mediated dilation, and the improvements are genuinely substantial in many cases. Let me give you some context about why nitric oxide is so critical to your cardiovascular system. When you're young, your body produces nitric oxide efficiently through an enzyme called nitric oxide synthase. This enzyme works well when you're metabolically healthy, getting adequate exercise, eating reasonably well, and not under chronic stress. But as you age, this enzyme becomes less efficient. Add in years of processed food consumption, chronic inflammation, oxidative stress from environmental toxins, reduced physical activity, and the natural decline in cellular function that comes with aging, and your nitric oxide production can drop dramatically. Some patients over 70 have nitric oxide levels that are barely measurable. Their arteries are essentially starving for this critical molecule that keeps them functioning properly. What happens when nitric oxide levels drop? First, your arteries lose their ability to dilate in response to increased demand. When you exercise or climb stairs, your muscles need more oxygen, which requires increased blood flow. Healthy arteries dilate to accommodate this increased flow. But stiff, dysfunctional arteries can't respond appropriately, which is why older people often feel exhausted from minimal exertion. Second, low nitric oxide levels allow inflammatory cells to adhere to arterial walls more easily, accelerating the development of atherosclerotic plaques. Third, blood pressure rises because the arteries can't relax and accommodate blood volume changes. Fourth, the risk of blood clots increases because platelets become more sticky and aggregative without adequate nitric oxide to keep them separated and flowing smoothly. Timing and consistency matter significantly if you want real results that translate into improved cardiovascular health. The optimal approach, based on what we see in clinical research across multiple studies, appears to be consuming roughly 200 to 250 milliliters of concentrated beetroot juice daily, preferably in the morning on an empty stomach for maximum absorption. Some patients prefer to divide this into two smaller doses, one in the morning and one in the early evening. The key principle is consistency over weeks and months, not occasional or sporadic use when you remember or when you're feeling particularly motivated. Your body needs sustained nitrate availability to maintain endothelial function and keep those arteries flexible and responsive day after day. Think of it as nourishing your cardiovascular system the way you would nourish any other part of your body that needs consistent support. The taste can be challenging for some people. Beetroot juice has a strong, earthy flavor that takes some getting used to. Some patients mix it with apple juice or carrot juice to make it more palatable. Others simply drink it quickly and chase it with water. What matters is that you get it into your system consistently. The benefits are dose-dependent and time-dependent. You're not going to see dramatic changes after one glass, but after 2 weeks, 4 weeks, 8 weeks of consistent daily consumption, the cumulative effects on arterial function can be quite remarkable. One thing I tell patients is to pay attention to how they feel over time. Many people notice improved energy levels within the first 2 weeks. They find they can walk further without getting winded, climb stairs more easily, or get through the afternoon without feeling completely exhausted. Some notice that their hands and feet are warmer, especially those who have struggled with poor circulation for years. These subjective improvements often precede measurable changes in blood pressure or arterial function tests, but they're real indicators that your cardiovascular system is responding positively. I understand the skepticism that many of you are feeling right now as you listen to this. You're thinking, if this really works so well, why hasn't my doctor mentioned it during any of my appointments over the years? Why isn't this standard medical advice given to every patient with cardiovascular concerns? The answer is complex and reveals something important about how modern medicine operates in the current healthcare system. Medical education focuses overwhelmingly on pharmaceutical interventions because that's what clinical trials emphasize, what insurance protocols are built around, and what generates the research funding that keeps medical schools operating and training new physicians. A simple dietary approach doesn't create patentable products, doesn't generate continuing education courses for physicians, and doesn't fit neatly into the 10-minute appointment structure that most doctors are forced to work within every single day due to administrative and financial pressures. Pharmaceutical companies spend millions of dollars educating doctors about their products. They sponsor conferences, provide free lunches, fund research studies, and create detailed educational materials about their medications. There's no equivalent infrastructure for promoting beetroot juice. No company is making billions of dollars from it, so there's no financial incentive to educate physicians or create the kind of robust clinical support system that exists for prescription medications. It's not that doctors are hiding this information deliberately or conspiring to keep you sick. Most physicians genuinely want the best for their patients. It's simply outside the standard treatment paradigm that most physicians operate within every single day. Another factor is that medical practice has become increasingly specialized and protocol-driven. Doctors are trained to follow clinical guidelines that are established by expert panels and medical societies. These guidelines are based on large randomized controlled trials, most of which are funded by pharmaceutical companies. Dietary interventions rarely get the same level of research funding or attention, so they don't make it into the official guidelines that doctors are trained to follow. A cardiologist who deviates from established protocols, even to recommend something as benign as beetroot juice, risks professional scrutiny and potential liability concerns. The system is designed to standardize care, which has benefits, but it also creates blind spots where simple, effective interventions fall through the cracks. There's also the issue of how medical appointments are structured. The average primary care visit lasts about 10 to 12 minutes. In that time, the doctor needs to review your history, address your chief complaint, order appropriate tests, write prescriptions, and document everything for insurance purposes. There's simply no time for detailed nutritional counseling or discussions about alternative approaches to supporting cardiovascular health. The system prioritizes efficiency and standardization over individualized comprehensive care. What I want you to understand deeply is this: your arteries are living tissue that responds dynamically to how you nourish them. Supporting endothelial health through dietary nitrates gives your cardiovascular system a fundamental tool it desperately needs, especially as you age and your natural production declines year after year. This isn't about replacing proper medical care or stopping medications without medical supervision. Never stop taking prescribed medications without consulting your physician. What I'm suggesting is an additional layer of support that addresses a physiological deficit that medications don't target. It's about understanding your body well enough to support it intelligently with tools that actually address root causes rather than just managing symptoms and numbers on a laboratory report. The beauty of this approach is its simplicity and safety. Beetroot juice has been consumed as food for thousands of years. The safety profile is excellent. The main side effect is that your urine may turn slightly pink or red, which alarms some people initially but is completely harmless. It's just the natural pigments from the beet being excreted. Some people experience mild digestive adjustment in the first few days, but this typically resolves quickly as your system adapts. There are very few contraindications. People with a history of kidney stones should exercise caution because beets contain oxalates, but for the vast majority of people, concentrated beetroot juice is extraordinarily safe. Think about what's possible when you restore proper arterial function. Better circulation means more oxygen to your brain, which can improve mental clarity and reduce fatigue. Better circulation to your extremities means warmer hands and feet, better wound healing, and reduced risk of peripheral vascular disease. Better circulation to your heart muscle means improved cardiac efficiency and reduced strain with physical activity. Better circulation to your kidneys means improved filtration and detoxification. The benefits cascade throughout your entire body because every cell, every tissue, every organ depends on adequate blood flow to function properly. I've had patients tell me that after 2 months of consistent beetroot juice consumption, they feel 10 years younger. They have energy they haven't experienced in decades. They can enjoy activities with their grandchildren that were impossible before. They sleep better because their circulation has improved. These aren't miraculous transformations. They're simply the natural result of giving your cardiovascular system what it needs to function the way it was designed to function. This is what excites me after 30 years in medicine. We finally understand that cardiovascular health isn't just about lowering numbers on a blood test. It's about restoring actual physiological function at the cellular level. It's about giving your body the raw materials it needs to repair and maintain itself. That knowledge is genuinely empowering, and it's something you absolutely deserve to have as you make decisions about your health for the years ahead. Your cardiovascular system will thank you for understanding what it truly needs to thrive, and you'll experience the difference in every aspect of your daily life.